on the topic handling of the prescription. As I already told you, prescription plays very important role. Okay, I have discussed with you parts of prescription. What are the prescriptions must be there? What are the elements should be there in the prescription? I have already mentioned to you. Okay, so the name of the patient should be there, the age must be there, the sex must be there, and all the things like what do you mean by RX? I have told you. What do you mean by inscription? What do you mean by superscription? What do you mean by subscription? Okay, and I have already told you what are the abbreviations. Everything I have told you in the last class. Okay, but today this is very important topic, that is handling of the prescription, which plays very important role. Okay, so why this plays very important role? Because what physician has written, that must be read by pharmacist. Yes or no? That must be read by pharmacist. So for example, if the physician has written paracetamol 10 mg, the physician has written to prepare the paracetamol tablet 10 mg. Example, a physician has written to prepare 10 mg of paracetamol tablet. Okay, the physician will write and the physician will send the prescription to the pharmacist. Okay, so in the flow and in the busy schedule, the pharmacist has seen that 10 mg, instead of 10 mg, the pharmacist has seen as 1 mg. Now, the drug which is prepared, the dosage form which would be prepared by the physician would be wrong, na? Because physician told to prepare how much mg? 10 mg. But here the pharmacist is going to prepare 1 mg. So, while handling the prescription, that is called handling the prescription, you need to follow all these elements. Okay, so you have to check for, when you receive immediately, okay, you will receive immediately, then you have to go for prompt reading and checking. Prompt reading and checking. And then you have to go for collecting the materials, what the physician has written. For example, in the lab, we have prepared syrup. What are the ingredients for the syrup? Sucrose and purified water. Okay, so you have to clearly check what are the ingredients given in the prescription. Okay, sucrose 66.7 grams, purified water 100 ml. Okay, you have to check it properly. Okay, so here collecting what are the materials has given by the physician, those materials you need to collect it. Okay, first you need to receive the prescription and then you have to read it and you have to check it properly and then you have to collect those materials which are there in the prescription. Okay, and then you have to weigh the materials. Just now I told you. For example, the physician has written the sucrose 66.7 grams. Okay, you have to weigh 66.7 grams only. Okay, let us make it round figure. I will make it 67 or I will make it 70. No. It's not GLP. What do you mean by GLP? Good laboratory practice. Okay, so whatever the physician has mentioned, for example, the physician has mentioned 66.75 grams of sucrose. Okay. For example, the physician has mentioned 66.75 grams of sucrose. Then you have to weigh 66.75 grams of sucrose only. Okay, madam, I will make it round. I will make it 66.8. No. I will make it 67. No, you should not do. I will make it 70, madam. No, you should not do. Okay, how much the physician has told, that much only you have to weigh the materials. Okay, now moving on to the compounding. What do you mean by compounding? So with the materials you have to prepare a dosage form. Like I have given you sucrose and I have given you purified water. Yes or no? Okay, by using those purified water and sucrose you have prepared a simple syrup. Yes or no? You have prepared simple syrup 66 IP. Like that, by using the weighed materials which were collected, you have to prepare one dosage form. That dosage form is called as compounding. We say that as compounding. Okay, and then finishing. So after that, you need to finish, wind it off like labeling. how you are doing labeling, packaging, and you have to distribute to the pharmacist. Okay, this is the whole scenario going on. I told you two types of prescription. What are those prescriptions? Extended prescription and also compounding prescription. This is the compounding prescription type because you are doing compounding here. Extended means already prepared one, like which one we are following currently. Currently we are following na. So the doctor will write already prepared tablets or prepared dosage forms or something else, right? So that is called as extended prescription. This is called as compounding prescription. Okay, so these are two types of prescriptions and these are the handling of prescriptions. Now I have explained you each and every element now. Okay, but again I have